Welcome back, everyone. Today, we're diving into something that affects literally millions of us, managing cholesterol. But we're not just doing a basic rundown of what cholesterol is. Think about your car for a second. You know when you're driving and that little check engine light pops on? Well, your body actually has its own set of warning lights to tell you when your cholesterol meds might need a little tweaking. Let's jump right in.
So ask yourself this, are your cholesterol meds actually working as well as they should be? It's a huge question. Now, don't get me wrong, statins and other cholesterol medications are absolute lifesavers. They drastically cut down the risk of heart attacks and strokes. But here's the thing, managing cholesterol, it is definitely not a one-size-fits-all kind of journey. What works perfectly for your best friend might not be the right fit for you at all. And this quote right here really hits the nail on the head. Cholesterol-lowering medications are not one-size-fits-all, and they're definitely not something you just set and forget. It's not a magic pill that instantly solves everything forever. The reality is, treatment actually requires ongoing monitoring and regular check-ins with your doctor.
To keep things simple, here's our roadmap for today. We'll start by understanding your treatment, then look at unmet goals and hidden markers. After that, we'll cover muscle and neurological side effects, liver and blood sugar signs, pregnancy considerations, and finally, why you should always consult your doctor.
All right, part 1. Understanding your treatment. The main thing here is just getting into the right mindset. We are looking for signs to adjust and optimize your health, not reasons to panic. Let's keep that car metaphor going. If your check engine light comes on while you're cruising down the highway, you don't just abandon your car on the side of the road, right? No, you take it to a professional mechanic. It's the exact same concept here. These 7 signs we're going to talk about are your dashboard warning lights. If one comes on, we don't throw the medication out the window. We go see our doctor, who is the expert mechanic for your body. Moving on to part 2, unmet goals and hidden markers. Interestingly, you can't actually feel these first 2 warning signs. They hide exclusively in your laboratory results. Which brings us to sign number 1, not hitting your personal LDL goal. Your target for bad cholesterol depends entirely on your personal cardiovascular risk profile. For example, if you have a history of heart issues, doctors are going to aim for a much lower target, usually under 70 milligrams per deciliter. But get this, data shows that half of patients fail to reach a healthy level even after 2 years of treatment. If that's you, it is definitely time to bring up this specific target at your next appointment. That ties right into our second hidden marker, sign number 2, elevated ApoB. We always hear about HDL and LDL, but ApoB is a major, often overlooked player. It's a protein that physically attaches to harmful fat particles and helps clog up your arteries. An ApoB blood test can give you a much more accurate picture of your actual heart disease risk, especially if you have high triglycerides or diabetes. Seriously, make a mental note to ask your doctor about an ApoB test next time you go in. Okay, part 3, muscle and neurological side effects. Let's step out of the lab and focus on what you're physically feeling, since your body loves to use discomfort as a built-in alarm system. And that leads us to sign number 3, muscle soreness and aches. You might hear this referred to as SAMs, or statin-associated muscle symptoms. It turns out anywhere from 5 to 20% of statin users deal with this. We're talking cramps, weakness, or just general aching. But why does it happen? Well, statins block cholesterol production, right? But they also slow down your body's production of something called coenzyme Q10, which your muscles desperately need for energy. Look, there is no shame in experiencing this. If it's bothering you, your doctor has plenty of options, like just adjusting your dose. Beyond just muscles, we have sign number 4, other side effects. This covers things like headaches, a weird tingling or numbness in your hands or feet, digestive issues, or that frustrating brain fog. Now, a quick note on memory. While short-term cognitive fuzziness can absolutely happen, research shows that true long-term memory loss caused directly by statins is incredibly rare. Plus, these issues are usually totally reversible. Again, the solution here is to bridge that gap and talk with your doctor, not to just suffer in silence. Part 4, liver and blood sugar signs. Let's shift our focus to some internal metabolic signs, specifically involving one of your hardest working organs, the liver. Sign number 5 is liver stress. Because statins do their heavy lifting right in the liver, we need to keep an eye out for a few specific physical flags. While it's quite rare, if you ever notice extreme unexplained fatigue, pain on your right side right under the ribs, really dark urine, or any yellowing of your skin or eyes, those are major red flags. If any of those pop up, you need to contact a medical professional ASAP to get your liver enzymes checked out. Moving on to sign number 6, rising blood sugar levels and an increased risk of type 2 diabetes. Recent studies have highlighted that statins can cause a slight bump in blood sugar. It seems they might alter your gut microbiome a bit, which can create a mild insulin resistance. Now, the increase is usually pretty tiny, but if you're pre-diabetic, this is an absolutely crucial thing to keep tabs on and bring up as a discussion point with your medical team.
All right, part 5, pregnancy and special considerations. We're shifting gears to a very specific life stage where the medical playbook has actually seen some really big updates recently. That brings us to sign number 7, pregnancy considerations. If you're pregnant or planning to be, the rules have completely changed. It used to be a strict automatic blanket ban on statins across the board, but in 2021, the FDA actually modified its warning. Now, doctors recognize that for certain high-risk pregnant patients, the benefits of staying on the medication might actually outweigh the risks. It's a perfect example of how medical guidance evolves over time and why coordinating closely between your cardiologist and obstetrician is absolutely vital. Finally, part 6, always consult your doctor. We've reached the climax of this explainer, and if you only remember one behavioral takeaway from everything we've talked about, make it this. As this list brilliantly illustrates, if your current statin isn't working for you, you are not stuck. Modern medicine has a massive arsenal of alternative treatments available. Your doctor might just tweak your dose, or maybe switch you to a different type of statin, like a hydrophilic one that doesn't penetrate muscle tissue as much. They even have completely different options now, like PCSK9 inhibitor injections or ACL inhibitors like bempedoic acid. The main point is there is always another route. So here is your ultimate 3-step game plan. Step 1, you notice a warning sign. Step 2, and this is super critical, you keep taking your medication. You do not just stop. And step 3, you call your doctor for a treatment tune-up. Quitting cold turkey without a professional supervision is incredibly dangerous for your heart. Now, I do need to quickly deliver our standard reminder that the information in this explainer is strictly for educational purposes. We're here to help you decode the science and act as a trusted health resource, but this is absolutely not a substitute for professional medical advice, diagnosis, or treatment from your own doctor. To wrap things up, I want to leave you with this provocative question. What is your body telling you about your heart health today? Your body is constantly communicating. You just have to know how to read the dashboard. So the next time you feel unusually tired or you get your lab results back, just ask yourself if all your indicator lights are green. Stay curious, feel empowered to listen to your body, and always keep that dialogue open with your doctor. Thanks so much for joining me today, and take good care of yourselves.